Case Study Group Project Kana by Group 4 by Chesney Walker, Taylor Kinslow, Brylie Popplewell, Maddie Shaw, and Sydney Reisinger.
Our client is Kana, who is 4 years and 6 months old. She has expressive language difficulties.
Client problem areas. It was reported that her sentences were significantly shorter in both languages. Language difficulties that are possibly result of her bilingualism. ESOL student who exhibits occasional syntactic errors and speech sound errors.
Reason for referral. Concerns. Kana's pre-kindergarten teacher, with 17 years of teaching experience, recommended that she be seen for a complete communication evaluation. Kana's mother reported that her sentences were significantly shorter in both languages than the sentences spoken by her 7-year-old sister when she was Kana's age. She described her speech as unclear.
Here we have listed Kana's test battery. Result of test battery. Based on evaluation results, Kana's oral motor development, voice, fluency, and pragmatic skills appear to be within normal limits for her age and gender. Kana's articulation profile presented with errors that were dialectical.
After analyzing the results of the test battery, we developed this treatment plan.
Based off of this treatment plan, we developed a lesson plan for therapy.
Goal 1. Kana will improve her syntactic development by increasing her MLU score from a 1.7 to at least a 3 in both English and Spanish. The MLU will be measured in the conversational context with familiar conversation partners in a familiar setting over the course of the spring 2021 semester.
Objective 1.1. Respond to requests, questions, comments with greater than 2 words in structured sessions. Objective 1.2. Kana will initiate conversations with familiar partners.
Goal 2. Before the end of the spring 2021 semester, Kana will improve her overall auditory comprehension or receptive knowledge of spoken direction to 25% above the baseline in both English and Spanish with minimal cueing in a structured therapy session.
Objective 2.1. Kana will follow one-step directions. Goal 3. Kana will improve her overall expressive communication in both English and Spanish with familiar listeners in familiar settings to communicate a variety of pragmatic functions with minimal prompts in 80% of opportunities over the course of the spring 2021 semester.
Objective 3. Kana will name or assign 20 everyday objects and or pictures in both English and Spanish.
Goal 4. The clinician will provide a minimum of 5 goal-oriented activities and/or educational resources for the caregiver to promote carryover of skills taught.
Objective 4.1. The parent will be instructed on what to do at home. Here is a visual of our lesson plan.
This is the form we will use to document Kana's progress.
In this activity, we are working on expressive language skills. Through the action of building a pepperoni pizza, Kana will respond to instruction with requests, questions, and comments. The clinician will go step by step on how to make a yummy pepperoni pizza. Kana will follow these directions by placing each ingredient on the pizza as directed, given a model first and picture cues. In this activity, we want Kana to ask what is next, request the next ingredient, and comment on her performance in order to utilize her expressive language skills. For example, after Kana has her pizza, she may ask the clinician what goes next. The clinician may tell her pepperoni goes next. Also, the clinician may ask her if she likes pepperoni or cheese pizza better, and this will elicit a response.
The next activity is Simon Says. During this activity, Kana will target her receptive language or comprehension of spoken directions through a modified game of Simon Says. The clinician will give a one-step direction. For example, Simon says to raise your hand, or Simon says to open your book.
In this activity, we are working on improving Kana's expressive language abilities through the action of utilizing a spin board with classroom cues. On this spin board, there are a variety of questions and requests that, if landed upon by the arrow, Kana must vocalize the prompt in order to initiate a conversation with the clinician. For this activity, Kana will be targeting her overall expressive communication through naming everyday objects on flashcards. Kana will pull a random card out of the baggie and name the item. For example, we would show Kana this photo, and hopefully her response would be plant.
For this objective, the clinician will give a parent this visual to take home at the end of the therapy session. This visual is a first, next, then visual. It includes activities for the parent to do at home with Kana. For example, first, help Kana expand her vocabulary. This includes activities such as encouraging her to order herself at restaurants and asking her who or what questions instead of yes or no questions. Next, it says, help Kana use her listening skills. This could include giving Kana one-step directions such as put your toys away or put your dish in the sink. Then it says, help Kana use her expressive language. This encourages them to name objects in the house as they use them. For example, as they cook, they could say, this is our stove. We use it to cook. At the end of each activity, we will use these candies as reinforcers to keep Kana motivated throughout the session.